the menu of AI like ChatGPT for many able is it ever to follow but it was without with real doctor.
So usually AI provides quick information in simple language. So people just go to AI for treatment.
Remember, I mean, it blew off on what the beauty of the shape of view of many and why it matters. Joining us in is Mona Motallebi, an expert in pharmacology known for her years of advanced drug delivery systems for diabetes. That, that you
Ah,
for being with us well. Let it be.
thank you so much. Hi, so good to see you.
Yeah.
Yes, let's get started.
Este walk from me in the in
So, yes, pharmacology is the basically study of the drugs, the medicines, how the medicines works in our body, what effect does our body show when we have the medicines. So, in simple words, it's the study of a branch of science that studies about different drugs. So, drugs basically we normally call it as medicines.
people it made below my would be
Yes.
what was it so important to do every and only a daughter can.
Yes, so actually the doctor gives us the proper medication, which medicine we should take, proper dose, proper time of the drug that has to be taken. So this self medication means taking medicines on our own can lead to overdose, can lead to harmful side effects, or even drug interactions. For example, like at times when we have a diarrhea or when we have a flu, we usually take antibiotics without advice. That can cause resistance, actually. So make this makes the future infections harder to treat. So that's why it's very, very necessary to take medicines prescribed by doctor only. And there are different painkillers that people they have. Even in with a small pain, they usually go for a painkiller. So that can cause an overdose. And when it is overused also, when you keep on having painkillers on yourself,
Yeah.
that can damage your liver, kidney, your stomach.
Yeah. Would you be happy what safe medicine is and why o médico do dizer.
Yes, so this self-medication is when we have medicine on ourselves
Yeah,
without prescription. Like, for example, if we have a fever,
yeah,
we do not go to the doctor and see what is the reason for our fever, what is the cause of our fever. We just pop in a paracetamol.
yeah.
Yeah. And because it is an over-the-counter drug, means that is available without the prescription, so that is why people just go and get it and then just eat it. But that, as I said, like that self-medication leads to many different, side effects in short term, in long term as well. Like in long term, it causes a lot of diseases that we are unaware of, which is actually maybe the reason for our self-medication. So that is why self-medication is mainly the reason that many of the antibiotics are becoming resistant. It means they are not at all anymore um, curing our disease, curing our, like, treating our diseases. So that is why it takes us a longer time. Even if, like, we are having a like, for example, antibiotic, we need to complete the course of the antibiotic. We should not just leave it like when we are cured with the treatment, or we are cured with the symptom. We must not leave the antibiotic there itself. Either we have to complete the course of antibiotic, or when prescribed by the doctor, of course, and not have it ourselves.
Then if you can determine be with you shape of good.
Personally, I would say self-medication is never safe, because even if you have a smallest fever, that is a cause of something, some kind of infection in your body. So even the slightest of discomfort is indication of something, when body is diseased, so but in case of like first aid or emergency, then one can have something to reach at least till the hospital,
Uh,
till you get the comfort for some few hours. But that should not be a case where we, depend on it.
yeah. Yenudi Yeva Yama Me Me Amen what of God new health problem.
Yes. So there are a few cases where patients, they had cough. So they started having azithromycin. Um, and then after a few days, they saw that, they have not been cured. So they again started having again a root, or like again a dose of azithromycin for 3 days. Firstly, they had for 3 days, then they had for 5 days. But then when they saw after 3 weeks, they saw that the cough is even worsening. So what happened was they had to take a higher dose antibiotic, a lot more higher dose antibiotic to get cured, and that too took a very long time. That is one case where we see how self medication actually delayed the process of treatment. um, so this was one case. Then we saw that a patient was getting recurrent urinary tract infection. So they would take antibiotics always,
Yeah.
prescribed by the doctor though. They would take antibiotics, but then after a period of time, because they were taking so much of antibiotics every time, their body started showing resistance. So they were not getting cured. Then they would take combination of antibiotics had to be given. They had to be given 2, 3 medicines together to be cured. So that actually
yeah,
harms other organs of the body as
yeah,
well, like the liver. It becomes very hard for the liver to metabolize it.
yeah. These many people are AI like ChatGPT for many advice. Is it ever safe to follow but advice without this with real doctor?
So usually AI provides quick information in simple language. So people just go to AI for treatment, but actually that is not the way. Um, we are actually misusing AI for self-diagnosis, and that may lead to wrong treatments. The safe approach to use AI is to maybe have general understanding, but we need to rely on professionals, on doctors for decisions, because AI does not get the full picture of the patient. Be it patient history, AI doesn't get, be it the tests, the results, different, what the patient is exactly feeling. Each and every point matters when it comes to diagnosis of a disease. So that has to be done with a doctor or a professional.
How do doctor and family help with medicine treatment and body?
So doctors and pharmacists, they have a very good relationship with each other. So in India, especially, we see that doctors are the ones that they prescribe medicines. But in foreign, we see in other countries, we can see that the doctor just diagnoses the disease, and it is the pharmacist that actually gives the medicine. So while giving the medicine, it is the pharmacist that actually makes the patient understand, makes it compliant to the patient, that how and at what time, when should the medicine be taken, with what particular food it gets interacted if they have. So all of these, it helps when a doctor is giving or a pharmacist is giving the medicine. They give a background of the medicine while giving to the patient. They must give. Now, it's not everywhere. Like if you can see in some of the hospitals, they just give and they just tell. But then there also, the pharmacist assists the patient in telling them, like you need to have it empty stomach or have it after food, have it twice a day. And in some cases where the patient is like illiterate, they cannot read, so the pharmacist or the doctor makes some signs on the strip
Yeah,
of a medicine. So that also helps the patient to get to know when to have in a day, how many to have, after food or before food to have.
yeah.
So these are the ways that the doctors and pharmacists help.
What does that mean?
So, drug interaction means when we are having the drug, when we eat the medicine, how does it interact in our body? You know, so there is food interaction, drug interaction. There are many interactions. So, with the food that we are having, with that the particular drug might interact, and then even with our any other medication, if we are having, if we are, for example, if I'm like having a blood pressure and I'm having one medicine, and with that if I take any other medicine, then that might interact. There are certain foods that they do not go with certain medicines. Like, for example, grapefruit doesn't go with a few medicines. Like, for example, immunosuppressant medicines, it doesn't go. So there are drug interaction, drug food interaction, there's drug alcohol interaction, drug supplement interaction. There are different supplements that people have. With that, there are many drugs that interact. So there are different ways in which a drug interacts in our body.
Can you tell us how in one minute we might cause problems?
Yeah, so it's not with all medicines. Like all, like for example, if we are having a say fever and a running nose, then we might have two medicines at the same time. That doesn't mean that it will interact with each other or it will cause some bad, adverse effect in our body. But there are a few particular medicines that actually interact with each other, you know. Like for example, say some are having antidepressants, so those interact when we are having, like for say example, if we are having alcohol, then it interacts with that. So there are a few things that we need to keep in mind while having specific medicines.
Is it important to finish the course of antibiotics even if someone recalls?
Yes, it's very, very important to finish a course of antibiotics because when we are having antibiotics, what happens is like um, we tend to kill the bacteria. Biotics means bacteria. So when we are having antibiotics to kill the bacteria or to reduce the amount of bacteria, so what happens if we stop antibiotics early, can leave some bacteria alive, and when these bacteria survive in our body, they again grow. They again grow, and then when they grow, they become resistant. They are even more powerful than what they were previously. So that's how they make infections more difficult to treat in the future. So that's why completing the full course of antibiotics helps ensure all the harmful bacteria are destroyed.
Yeah. Diabetes is one of the more common health problems with what are the big changes in making diabetes safer and more effective?
Yes, the diabetes is actually a biggest challenge in the whole world today. So we must understand how like we get diabetes. So we might have diabetes genetically, but mostly there are two types of diabetes we must know. One is that our body does not at all, form the insulin, which is a hormone that helps to, lower the blood glucose level in our body. So this particular hormone, when it is not at all formed genetically, that is called type 1 diabetes. And when our body produces insulin, but when our cells, they are not able to take it into itself and take the blood sugar level into it and dissolve it. So then that is called type 2 diabetes. The body makes insulin, but cannot use it properly. So we call it insulin resistance also. Yeah. So in that case, this particular type 2 diabetes is basically caused because of our lifestyle, our food habits. Um, so there are different, reasons to it. There is no particular one reason for it happening. But mostly it is because of our lifestyle, sedentary lifestyle, the food that we eat. So how we can, overcome it is that we need to have a proper diet, eating healthy foods,
yeah,
exercising regularly, maintaining a healthy weight, managing stress, getting enough sleep, especially. This keeps the blood glucose levels stable. And with food, we can try having proteins, veggies, fruits.
mm,
Foods high in sugar must be avoided usually. Yeah, because they, quickly raise the blood glucose level. So a balanced diet with whole grains, fruits, vegetables, lean protein, these are
mm,
helpful.
yeah. Will be the surviving or in the allow how many is work in our body.
Yeah, facts for how medicine work inside our body. So medicines, when we